So having shared my eye concerns with you, or eye area concerns rather, I want to share with you what I do to preserve my eye area. The first thing is every single day I put an eye cream on. And I normally change between creams, but currently I'm using a retinol eye cream, and I also use an eye serum. The eye serum is very firming, it's packed with active ingredients, peptides, very anti-aging, but contains no retinol. And then of course the eye cream that I use has got hydrating ingredients in, and it's got the retinol in. So that I do at least twice a day, so morning and night I'll put something on. If I travel, I might not always take my eye products with me, depending where I'm going and how much luggage I want to cart around with me, but my day cream that I use is packed with antioxidants, and I can use that on my eye area if I choose. And for a short period of time, like a weekend in the bush, it really is the perfect thing to not take so many things with you. Then when it comes to doing a deep chemical peel, I do the medium depth chemical peel that you saw me do earlier this year, and I can do it maximum twice a year on my whole face, and I always include my eye area. I also love the lighter TCA peels. I've got a 12% that I normally do 2 layers on my eye area, or a 15% which I normally do 1 layer on the eye area. And if I had to average it out over the year, I'd say I do this every 3 months. I could sometimes once a year do a course of microneedling treatments, and I would do 4 treatments, 1 a month for 4 months. I sometimes combine that with the TCA peel, where I needle the skin and then I put a TCA on my areas that really concerns me. Of course, I do this with care. Only when my skin is really good and it's healthy and there's no sensitivity, then of course I can do that. But something that's been an absolute game changer for me, besides my maintenance treatments and treatments, yes, the chemical peels and the needling has changed my eye area, but Botox has been amazing for me. So you get different brands. Botox is a brand, and that's the one I particularly really react well with. So that's what my doctor used on me personally. But it is botulinum toxin type A, which is the toxin that's injected to relax the muscles. So when I go to my doctor, I ask for the brand Botox, and she knows. And basically she'll inject my forehead, she'll inject around my eye area. But for my deep-seated crow's feet, that has made such a difference. I need to go for my Botox injections normally every 4 months. And it is absolutely incredible. And I can see that I'm due for my injections now, because I can already see the eye area is just not looking as fresh anymore. And it is just incredible. So I'm a big fan. At the end of the day, you've got to do what's right for you and what is your concern. And of course, I would never ever go and have any botulinum toxin type A injections with someone that's not very well qualified. I would normally recommend a plastic surgeon or an aesthetic GP, specifically in South Africa. I know in other countries, other type of people can do it, as long as that person really has done good training, because of course you do not want droopy eyelids, and there can of course be some things that can go wrong. And then it's not necessarily the product that's been injected, but it could be the person doing the treatment.